Hello friends, let us now see the next question in our series MCQ for you. All right, I'm Dr. Amit Desai and I am a general surgeon and I teach anatomy and surgery for FMGE as well as for NEET PG. All right, so let us look at the next question. Spontaneous peritonitis. Now, when they are talking about spontaneous peritonitis, they are basically talking about spontaneous bacterial peritonitis. In cirrhosis patient, the polymorphonuclear cells are. Okay, so they want us to tell them that how many polymorphonuclear cells, PMN cells, should be there, all right, to diagnose a spontaneous bacterial peritonitis. All right. Now let us first see what is spontaneous bacterial peritonitis. Very often we give it as an abbreviation SBP, spontaneous bacterial peritonitis. All right. And most often this is a complication of ascites that we usually see in a patient of cirrhosis. Okay. This is usually a complication of ascites that we see in a case of cirrhosis of uh, liver. All right. And it is, as the name suggests, spontaneous infection. It's a spontaneous infection. So if somebody has ascites, there is almost 10 to 30% chance that they will develop SBP, spontaneous bacterial peritonitis. Now, which is the organism which is responsible? So if you're looking at the adult patients, then the commonest organism would be Escherichia coli. The second common organism would be Klebsiella. But instead, if you're looking at a child, then the commonest organism would be a Streptococcus. Okay, group A Streptococci. Group A Streptococci. Now, what is the diagnostic criteria? When will you diagnose it? So there are two things that we need to have for diagnosis. What are the two things? One is that there have to be more than 250 polymorphonuclear cells in the ascitic fluid. All right. And the second criteria is that the culture of the ascitic fluid should show only one organism, only one organism. The moment you see more than one organism, now you are supposed to suspect secondary, that means some perforation, some other cause of peritonitis, some infective peritonitis, all right? But if you are diagnosing SBP, one is that the polymorphonuclear cells have to be more than 250. Two, the culture of the ascitic fluid should show only one organism. So here, nowhere have they mentioned 250, all right? But we see that 300 is the nearest figure. Okay, if you see 250 lies somewhere in between these two. And since it has to be above 250, it cannot be 200. So the nearest value over here is 300. So in the exam, if such a question comes, and if there is no negative marking, then you better mark 300 cells per cubic millimeter. All right. This would be our answer. This would be our answer. All right. So if you like this video, please subscribe to our channel ADSL Academics. Please like the video and also press the bell icon. So every time we post a video, you will be notified about the new video. All right. Thank you very much.